Welcome to another episode of Medical Myth Busting. Today we'll just discuss something very important, some of the symptoms that you must take very, very serious while pregnant. For example, are you the kind of woman that when she's pregnant, she have persistent headache? Are you pregnant and your legs are swollen? Are you pregnant and you're having blurry vision? Are you pregnant and you're having chest pain? Are you pregnant and you are feeling confused? If you have these symptoms, then there's high tendency that you are playing with preeclampsia. Yes, preeclampsia. Preeclampsia is simply most times elevated of blood pressure over 140 millimeter of mercury over 90 millimeter of mercury after it has been measured 4 hours apart. And when they take your urine, they will find proteins in your urine. Most people will say, most doctors and most scientists say above 300 milligram over 24 hours, this is usually preeclampsia. Sometimes this preeclampsia is really not symptomatic, but when you are not having these symptoms, then it is something that cause for alarm. So because of the fact that most times it is not symptomatic, it is encouraged that when you are pregnant, quickly register for antenatal so they do some certain tests for you, and if there's any problem, they'll start tackling it right from the onset. Now, those people, there are some persons that are classically at risk of developing preeclampsia. These people, they are women who already have hypertension before pregnancy. Now, preeclampsia usually occurs, most times are diagnosed after 20 weeks of gestation. If you have hypertension before 20 weeks of gestation, most times they call it either pregnancy-induced hypertension or maybe chronic hypertension. You have been hypertensive even before you got pregnant and you are not aware. So, but usually pregnancy preeclampsia occurs is diagnosed after 20 weeks of gestation. As such, it is important that you register your antenatal as soon as possible. There is no time that is too early for antenatal. In fact, as soon as you get pregnant, as soon as your diagnosis of pregnancy is made, it is recommended that you register for antenatal as soon as possible. And in fact, those persons who have bad obstetric history, they are usually advised to even start what we call preconceptional care even before they got pregnant. Okay, so if you have all these signs, these are signs or symptoms of preeclampsia. Now, some women also have bleeding in their early pregnancy. They do have blood coming out of their vagina, vaginal bleeding, and as such, some will even think that it is normal. No, sometimes it may be normal. It could just be implantation bleeding, but most times it is not normal. It is recommended, if you are pregnant and you see blood, it is recommended that you see your doctor. Your doctor examine you and encourage you to do some certain investigation to rule out some other underlying pathology. So when you are pregnant and you see blood, it's also a danger sign in pregnancy. And some people will say, "Doctor, I am pregnant, I am menstruating." It is usually, I will not say never say never. We usually say never in medicine, but it is usually an abnormality. If you are pregnant and you keep seeing blood, as at when you want to see period, that time you usually see your menstruation and you are bleeding, it is recommended that you see your doctor. It could just be a telltale sign that either you are passing through threatening miscarriages or you are having placenta previa. If it is abruptio placenta, it will be involved. There is serious pain that will accompany this bleeding. So most times, placenta previa does not have accompanying abdominal pain. So all these are telltale danger signs of pregnancy. You are pregnant, you are seeing water coming out, you are having rush of water coming out. It is also a danger sign. In fact, if you are leaking water, they say water don't burst, you are leaking water, your amniotic fluid is leaking, you immediately go and see your doctor. If not, you may develop what is known as choroamnionitis, and it will kill you, it will kill your baby. So all these are some of the danger signs that people take for granted. Now, some of the things that people do while they are pregnant, when they see all these things, they rush to a nearby pharmacy and they give them progesterone injection. It is not advisable you do that. Go to and see your doctor. If it is bleeding, he examine you and do some certain investigations. If this pregnancy can survive, they will tell you what to do and they will ensure that this pregnancy survives. If it is a pregnancy that is high risk that will not survive, then they will tell you what else to do. Another bad signs of pregnancy is a woman that keep having recurrent abortion, recurrent miscarriages. These women sometimes could have other diseases such as cervical incompetence, antiphospholipid syndrome, and other kind of things that can result to persistent miscarriages. So if you have the first pregnancy result to miscarriages, it could be that the pregnancy is ill form and the body expurges it. But if it is persistent, anytime you are pregnant, you lose the pregnancy, my sister, it is very, very essential that you quickly see your doctor, and such you need to register for antenatal as soon as possible. Thank you so much for your attention, and make sure you check your blood pressure as soon as you get pregnant, and make sure as soon as it is diagnosed that you are pregnant, the two line have shown, it is very important for you to start talking with your doctor. It is very important for you to take your antenatal processes very, very, very serious. Thank you so much and have a wonderful weekend. Bye bye.